Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel if you have not, and call us on 76967 for the best OET coaching. This is Dr. Bhupesh once again for you. So yeah, I'm just going to do this speaking task, which has been created by Cambridge Box Hill. Basically, it is part of OET organization itself. So the Cambridge University. So there was a speaking in the last exam, which was the same speaking like this only. So it sometimes, if you are highly fortunate, can happen that the same speaking can come, which we practice. So please do not ignore anything. If something comes your way, please try to learn from that video. So I'm just going to do this speaking. In this speaking, what is happening is that you are a nurse and your patient is 62-year-old and he came to you yesterday for the renal cyst removal. Operation went fine, but patient is still having lot of pain. This task is little different because normally patient will say, I want to go home. But this task is little different because in this patient is saying otherwise. He's saying that he does not want to withdraw from IV morphine. That means he wants to continue IV morphine. So this task is little different. You have come to counsel the patient on the post-operative pain relief and medication control. So that is what you have come for. Explain reason for seeing the patient, discuss post-operative pain relief and medication. So the first point that you have to say, again, in OET, you will get this task for 3 minutes. Whether you are a doctor or you are a nurse, you will have 3 minutes to prepare this task. So please utilize these 3 minutes. It's very, very important. So what you will do, so in these 3 minutes, what you will do, you will try to write everything you can. So explain the reason that I am here to discuss about this. Find out how the patient is feeling, any changes in pain or concerns. So when you will ask the patient ki, how much pain are you feeling? So is there any change in the pain? Is it getting less? So kahega, no, pain is same and I am highly worried. That's why I want to continue IV morphine. So usko ko, I reassure you that this pain is a part of healing process. And OET सबसे अच्छा क्यों है? This pain is, सिर्फ is word लगा रहे हो आप. This pain is a part of healing process and it will gradually improve. So please don't worry. और उसके बाद एक line बोलते हो, so please don't worry. Find out. So second thing I would like to ask you that how have you been doing? Are you doing any physical activity? Simple. Are you doing any physical activity? तो अभी तक हमने क्या लिखा है? अगर मैं अभी तक आपको लिख के दिखाऊं तो आप क्या बोल रहे हो? Let me make it clear to you. Let's see. So good morning. My name is, अपना नाम बोलना है. So in my case, my name is Bhupesh, but it is not a doctor's task. Otherwise, I would have said Dr. Bhupesh. But in this, I will say my name is Bhupesh. I am a nurse over here. I am a nurse. हमेशा फर्स्ट लाइन लिखनी है जैसे मैं लिख रहा हूँ. Whether you become expert of OET speaking, फर्स्ट लाइन हमेशा लिखनी है. गड़बड़ हो जाती है यार, गलती से नर्वस होते हैं. तो प्लीज फर्स्ट लाइन लिखनी है. I am a nurse over here and first of all, अगर करना चाहते हो, first of all, I would like to confirm your name. क्योंकि वो आपके हॉस्पिटल में ही है तो फर्स्ट सबसे पहले कंफर्म कर लो नेम को. तो इसको इस लाइन को लिख देना. कंफर्म योर नेम. इज योर नेम मिस्टर जॉन? सो दिस इज व्हाट यू कैन डू. इज योर नेम मिस्टर जॉन? अगर गर्ल है तो आप मिस मारिया बोल देना. सो वो आपकी मर्जी है, जो भी नाम आपको आसान लगता है. सो मेरे लिए दिस इज एन ओके नेम. So good morning, my name is Bhupesh. I am a nurse over here. And first of all, I would like to confirm your name. Is your name Mr. John? So the patient will say yes. Okay, Mr. John. So I have come here. So Mr. John, I have come here. बस इतना लिखना है. I have come here. बाकी सब आपको दिया हुआ है. I have come here. उसके बाद बोलोगे to के बाद बोलोगे I have come here to discuss about this thing. So आप बोलोगे I have come here to discuss about your post-operative pain relief and medications. So first of all, I would like to know how are you feeling. So always try to write things. Again, I don't know whether it was visible or not, as sometimes it is happening with us. So I'm just going to write again. So good morning. My name is Bhupesh. I am a nurse over here. Please forgive me for the spelling because already I have taken your time. I don't want to repeat the same thing. So I'm a nurse over here. And first of all, I would like to confirm your name. Is your name Mr. John? So patient will say yes. Okay, Mr. John. So I have come here to discuss about जो same line दिया, to discuss about post-operative pain relief and medications. But before I do that, I would like to know, बिल्कुल ऐसे प्रैक्टिस करो, लिख के देखो. मैं भी तो आपके लिए, आई हैव बीन टीचिंग ओईटी सिंस 11 इयर्स, सिंस लास्ट 11 इयर्स, फिर भी लिख रहा हूं ना आपके लिए. जब आपको आज हम स्पीकिंग डिस्कस कर रहे हैं लेकिन अच्छे से काम कर रहे हैं ना, अच्छे से करो अपना काम, जल्दी मत करो. सो आई हैव कम हियर फॉर दिस, बट बिफोर दैट आई वुड लाइक टू नो हाउ आर यू फीलिंग. Well, nurse, I am feeling lot of pain, this and this. See, as you know, yesterday your surgery was done. Passive voice, your surgery was done. So some pain is obvious. Do you think it is comparatively less? आप ऐसी बातें कर सकते हो पेशेंट को. Do you think it is comparatively less than before? वो कहेगा no nurse, that is what is the reason to worry, that my pain is absolutely same and it is not decreasing at all. Sometimes I am feeling that operation was not done nicely. So जब भी आपको पेशेंट नेगेटिव बात करता है, always say no, there is nothing like that. No, there is nothing like that. Your surgery, सबसे पहले उसका यही पॉइंट करो. Your surgery your surgery is successful. So pain, अब उसके बारे में अब यहीं से अपने पॉइंट को करो कि let me tell you about, let me reassure you that this pain is part of healing process and it will get gradually improve with time. So please understand there is nothing to worry. Also, I would like to ask you, are you doing any physical activity? No nurse, I am not doing any physical activity because I am really worried. I have not got out of my bed even because I am feeling lot of pain. See, please try to understand the importance of physical activity. फिजिकल एक्टिविटी विल, सिर्फ विल लगाना है आपने. फिजिकल एक्टिविटी विल एलिविएट. इस एलिविएट का मतलब होता है रिड्यूस. मैंने आपको हमेशा कहा है ये वर्ड आपकी वोकैबुलरी में रीडिंग के लिए भी होना चाहिए. इस एलिविएट, ये बोलते हैं एलिविएट. एलिविएट का मतलब रिड्यूस. सो फर्स्ट प्लीज अंडरस्टैंड दैट फिजिकल एक्टिविटी विल एलिविएट योर पेन एंड इट विल हेल्प इन द हीलिंग. एड का मतलब होता है हेल्प. इट विल एड इन द हीलिंग, फुल स्टॉप. मतलब रुकना है. ऑल्सो physical activities will improve your blood flow and reduce the risk of blood clots. So please understand Mr. John. अब उसका एक आधी बार नाम भी लो. So please understand Mr. John, it is very important for you to do physical activities as has been advised by the doctor. So please understand it is very important. Also, I would like to tell you that daily walks will play a very important role in recovering quickly. So please continue with your physical activity and also try to do daily walks. Are you getting? और यहाँ पे सबसे इंपॉर्टेंट चीज, आर यू गेटिंग माई पॉइंट. मतलब इस चीज के बहुत मार्क्स हैं, ये बहुत इंपॉर्टेंट है. आर यू गेटिंग माई पॉइंट? अगर एक्सप्लेन दोबारा करना है, दैट डेली वॉक एंड रेगुलर एक्सरसाइज इज वेरी इंपॉर्टेंट. एंड ये बहुत इंपॉर्टेंट है. पेशेंट से दोबारा पूछना, दिस इज वेरी इंपॉर्टेंट. ये बहुत इंपॉर्टेंट है. सो आर यू गेटिंग माई पॉइंट दैट डेली वॉक एंड रेगुलर एक्सरसाइज इज वेरी इंपॉर्टेंट. Are you understanding? वो कहेगा I am understanding but I am having lot of pain. Don't worry, let me tell you that obviously pain is again as I again. उसको जब वो दोबारा बार बार बोल रहा है तो इस लाइन को बोलो, as I have told you earlier. As I have told you earlier, ये लाइन भी आपके पास होनी चाहिए. As I have told you earlier that it is common. Please understand. And also I would like to tell you that I am here to tell you that we will be withdrawing. अब ये वाला point आप अपने आप बोलो. Also I would like to tell you that I am here to tell you that you will be soon withdrawn from IV morphine. Well nurse, I don't want to withdraw from IV morphine. This is very important. Please understand that it is very important to withdraw from IV morphine because there is, सिर्फ आप वर्ड क्या डाल रहे हो, there is. देखो आप ओईटी में बस ये लिखते हो, बाकी सब दिया हुआ है. Because there is risk of dependency and increased risk of constipation. Also, it can lead to nausea, vomiting, and drowsiness. So it is very important to withdraw IV morphine. But nurse, how would it happen? Let me tell you about the next steps. First of all, doctor will come and he will review the morphine dose, will change it to oral morphine and replace the morphine with paracetamol. So this is what is going to happen. So you will be soon on the oral drugs rather than IV. So I think you are glad to hear that. Well, no nurse, I'm not glad to hear, rather I'm really kind of shocked. I don't know, my pain is still there. Please don't worry, as I have told you that this IV morphine can lead to dependency and other complications. So please understand, it is very important, and also after taking the oral medications you will not feel any pain. Further, I would like to tell you that oral morphine effect is long lasting. It is going to last for longer, and also it is released slowly in the by in the form of oral dose. So that means the release would be slow and also it would be long lasting. So you will feel less pain for the long time. Are you getting my point? Well, yes, nurse. Okay. So now I will advise you to speak to the doctor about the pain relief when doctor come for the next ward. Is it okay for next round? Is it okay? All right, nurse, I will try. Well, I'm glad that you have understood. I'm glad that you have understood everything. Otherwise, सबसे पहले पूछो, so have you, सबसे पहले पूछो, so have you understood everything? ये बहुत इंपॉर्टेंट है, मतलब ये नहीं बोला तो स्पीकिंग में 340 330 रह जाएंगे. ये बहुत इंपॉर्टेंट है. Have you understood everything or should I repeat anything? ये बहुत इंपॉर्टेंट है, बहुत इंपॉर्टेंट है. Should I repeat anything? Well, no nurse, I have understood everything. I am glad that you have understood everything, and now I am leaving. But I would like to highlight the key points again before leaving, that it is very important for you to switch from IV morphine to oral morphine, from IV morphine to oral morphine. So this is very important for you. So please ask the doctor for the same when he comes for the next round. तो कोई भी जो दो important line है वो बोल दो कि IV morphine से आपका जाना है. So please ask the doctor when he comes on the next round. Is it all good? Okay, then I am leaving. Take care. And I reassure you that you will be fine soon and your pain will be relieved soon. There is nothing to worry. We all are here to help you. There is nothing to worry and we all are here to help you. बस ये पेशेंट को रीअश्योर कर दो कि हम सब आपके लिए ही हैं. यानी हमेशा पॉजिटिव. अगर आप टोटल इंग्लिश में देखो, बस आप ये बोल रहे हो, बाकी सब आपको ये दिया. इसीलिए ओईटी सबसे आसान टेस्ट है. दैट इज व्हाट आई ऑलवेज से. ऑब्वियसली थोड़ा बहुत एनर्जी तो हर चीज में लगेगी यार. थोड़ा बहुत फॉर्च्यून अपना रोल प्ले करेगा, कभी अच्छा कभी बुरा. यू नो, छोटी छोटी चीजें चलती रहेंगी, बट स्टिल आपने कभी इससे आसान नहीं दिया होगा. याद करो, जब हम नर्सिंग में होते थे, हम वेट करते थे कि गलती से कोई पेपर का बस एक क्वेश्चन बता दे, और आप उस चीज से रियलाइज करो कि आपको पूरा पेपर बता दिया है. आपको सिर्फ उसको देख के बोलना है. वाइवा से पहले भी हम कहते थे, अच्छा अच्छा बताओ, अच्छा अंदर कौन सा क्वेश्चन पूछ रहे हैं, एक्सटर्नल वाले वाइवा में क्या पूछ रहे हैं, इंटरनल सर भी पार्टिसिपेट कर रहे हैं. ये बेकार बेकार की बातें भी जानना चाहते थे हम, जबकि पढ़ने का भी टाइम नहीं था उसके बाद. यहाँ पे तो आपको सब कुछ सामने दिया है, तो आपको सिर्फ बोलना है बिल्कुल ऐसे. सो प्लीज अपने हाथ से लिख के देखो, प्रैक्टिस करो, इन लाइनों की इंपॉर्टेंस को समझो. नो देयर इज नथिंग लाइक दैट. जब भी पेशेंट कोई गलत बात बोलते हैं, प्लीज अंडरस्टैंड देयर इज नथिंग लाइक दैट. बड़े पोलाइटली बोलना है, नो देयर इज नथिंग लाइक दैट, योर सर्जरी हैज बीन. हमेशा पॉजिटिव पॉइंट पे खत्म करना है. अगर आपने यहाँ खत्म कर दिया तो ये गलत बात है, ये नेगेटिव बात है. नो देयर इज नथिंग लाइक दैट. पेशेंट कहेगा आप तो मेरी बात ही नहीं मान रहे. तो ऐसे नहीं करना. नो देयर इज नथिंग लाइक दैट सर एंड मैम, योर सर्जरी इज सक्सेसफुल, देयर इज नथिंग टू वरी. Are you getting my point that these two things are very important for your quick recovery? As I have told you earlier that this pain is common, so there is nothing to worry. Last May, have you understood everything or should I repeat anything? I am glad that you have understood everything and now I am leaving. But before I leave, I would like to highlight the key points that it is very important to switch you from IV morphine to the oral morphine. So please ask the doctor when he comes to you for the next round. and I'm leaving now, and I reassure you that this pain is pretty normal and it will be relieved soon, and there is nothing to worry. We all are here to help you. Is it all good? So that is how you do the speaking. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you.